Hi everyone, it's me again, Stacy. I just wanted to give an update on how I'm doing, and I wanted to also answer a few questions about how much my surgery cost when I had it. So first of all, I'm doing very well. After I stopped turning, it's been smooth sailing so far. Today is day 107 post-op. I can't believe it's been this long with this fixator on my toe, but remember, results are not typical because my toe was, man, I wish I had the exact measurements because that would be perfect, but my toe was really, really short, so it took a really long time to lengthen. So I was turning for over almost 50 days. I was turning. So you have to keep your fixator on after you're turning just about as long as you've been turning. So if you're turning for 50 days, you're pretty much going to have it for another 50 days on while the bone heals. My last appointment with Dr. Lamb was February 28th. Sorry, February 26th. It was a Monday. And I saw him early in the morning. We did an x-ray. Bone is filling in very nicely. But my foot was not ready. It was not ready for the fixator to come out. He gave me an option where he said, because I told him I would be going out of town to California. I live in Florida, so it's a long flight. And I was praying and hoping that my pins would be out by then. So he gave me an option where he was saying, it was Monday when we were talking, he said, we can go into surgery next week if you want to, where the bone is not completely healed, but he would take out the entire fixator and the K-wire that's at the tip of my toe, and he would put two pins perpendicular to each other. So he would put a pin right here, because it's the fourth metatarsal that's short, so he would put one right here, then he would put one on the side like this, so they would cross each other, and so it would be a lot less bulky, and it would be able to hold my foot together until the bone was completely healed. I was very, very into this option. I really wanted it to happen, but with my schedule, I did not have time for surgery, and so if I scheduled that surgery for the two pins to be put in and for the fixator to be taken out along with the K-wire, I would have had to keep those two pins in for an additional 4 weeks. And at the time I was talking to him, my fixator just had to stay on for another 5 to 6 weeks. So it didn't make sense to go with the two pins. So I'm just going to keep the fixator in. I scheduled my removal surgery with Angela, his what is she? She's his booking secretary, I believe. I need to look into her actual title. So I apologize. But Angela is amazing, and she is great with communicating and getting back to you. And she called me a couple days later and she said, I'm ready to schedule your removal, and I was really excited. So my removal is scheduled for April 6th, in the same place that I had the surgery. I don't have a time yet, but I'll be in to take the pins and the fixator out. I'm actually going in to have the surgery, going under general anesthesia again. A lot of people go into the office and he just takes the pins out. He tells you to take a strong painkiller and he just takes the pins out right there. But for some reason, I'm going into the OR. Also, I have to have the surgery because my joint needs to be repaired. I don't know if I mentioned this in the last, I believe I did in the last video or a couple videos ago. The joint on my brachy toe is oval and your joints are supposed to be round. And because it's oval, as I was lengthening my toe, it was colliding with my third metatarsal. So that will cause pain once the pins are out. So he's going to go and he's going to round it out and, probably shave it down or whatever. So we're going in for round 2. of surgery. But I'm really excited to get these pins out of my foot. It has been not a roller coaster, actually. It's been a long train ride. I feel like at first it was a roller coaster. Before I could walk, it was really tough. But remember, I am a case where it takes me a really long time. It took me a really long time to lengthen. And so my fixators have to be on for so long. And I think that's what contributed to the roller coaster at the beginning, because there's a whole lot going on in my foot. For people who don't have much length to go, you might still feel like it's a roller coaster, but I feel like it goes by a lot quicker because you don't have the fixator in for much long. A lot of people, their fixators are in for 2 months and, they're good. They start the physical therapy and, they're fine. But like I said, for me, it's a long ride, but I'm enjoying the ride because I look forward to the end results. I also wanted to talk about the cost of the surgery. Excuse me, because I had the bill here and I can't find it anymore. I don't know where it went. It just grew legs and walked away. But I remember the price because it knocked the wind out of me when I saw it. So I remember it specifically. So before I talk about the price of surgery, remember to call your insurance. Call your insurance and talk about your copay, because you do not want to be surprised by anything when you come out of the hospital. And I don't want you to be sent to collections. So when right before the surgery, I was already booked and scheduled for the surgery. I still didn't know how much it was going to cost. It was driving me crazy because I didn't want to come out with a bill that was thousands of dollars, because I knew I wasn't going to be able to afford it. So I called my insurance, and all they kept telling me was, if you stay in the hospital, $600 a night. That's all they said. And I was like, what does that even mean? What about the surgery? I'm not talking about the hospital stay. And the person that was helping me couldn't really help me. And I ended up calling again, and I got a really nice person who was speaking to me, and she told me it's just going to be $600 if I stayed the night. So I was like, this don't sound right, but okay. All right. By the way, I had Florida Blue Health Insurance. So I went in, had my surgery, went home. Nobody asked me for payment. Cool. A couple weeks later, got a statement in the mail, and I was sweating a little. And it was $77,000. And I was like, whoa. So from that $77,000, it got adjusted down to about $42,000. And the insurance paid the $42,000. So that's, the surgery cost $77,000. And that was just my one foot. I don't have it on both feet. Just my one foot was $77,000. I saw that somebody's surgery was a lot cheaper than mine, and they had it on both feet. I don't know. Maybe it was a cost per foot. I don't know. But I'm telling you, for me, my one foot, $77,000. It was adjusted down to $42,000 and some change. And all of that was paid by the insurance. I had to pay directly to St. Mary's Medical Center $600 for the stay at the hospital, which I had no problem paying because I had an amazing experience at St. Mary's. They were amazing. So I look forward to being there again after my next surgery. Don't look forward to another $600. Actually, my insurance has changed since then, so it might be something different. We will see. But I look forward to the amazing experience that I feel every time I go there. So yes, that's how much the insurance costed. There was a breakdown of like how much went to anesthesia. There was like, out of the 77, big bulk of that went to anesthesia. Anesthesia is really expensive, and to equipment. Equipment is really expensive as well, and all of that stuff. So that's how payment went for the surgery. St. Mary's Medical Center will send you a bill for the entire how much you owe for the surgery, but they're really good with working with you and talking with you. I set up a payment plan, and it just comes out. You get to pick a date when you want it to come out every month, and it comes out on that date every month, and it's perfect. So I would recommend that because it's a lot less stress off of you. My medication was really cheap. I want to say we walked out of there with the oxycodone, the antibiotics, and the Valium. I want to say we paid less than $15. I want to say, listen, I will find the exact prices to everything, and I will either update the description box sometime soon after I upload this video, or I will come and make another short video where I give you guys the exact pricings. So yes, remember to call your insurance, talk to them, tell them about it. Dr. Lam is really good with wording how the surgery, I don't want to say he's really good with getting their surgery approved to be paid for with your insurance, but remember, a lot of insurances think that this is a cosmetic procedure and that we just want it because it's ugly. So a lot of them try not to pay for it, but the way that your doctor words it is very important, and Dr. Lam is he's an expert with that, because they didn't give me any issues, but there have been people where their insurance have told them. I've had doctors who told me you're going to have a really hard time getting this paid for. And Dr. Lam, that was my first question. And Dr. Lam was like, listen, I can't pay for a surgery that's thousands of dollars. Help me. And he was like, I've never had an issue. And I didn't have an issue because of him. So I'm thankful for that. So call your insurance. Make sure you ask them every question you have on your mind. And that is about it. So yeah, like I said, I'm doing well. Fixators are doing well. I, knock on wood, haven't had another infection since the last infection. All cleared up. I'm still applying betadine to my pin sites because it kills bacteria. So after I take a shower, I blow dry my pin sites. Once they're dry, I spray betadine. I wrap the gauze. I wrap my foot with the ace bandage, and I'm good to go. So that has been helping very much so. I'm still taking a shower on the folded chair, thanks to my mom. And that is about it. I don't know if you guys have any other questions. If you do, please don't be afraid to ask. I don't want to say before the end of this weekend, but early next week, I will post a video of the way I'm walking and pictures of the toe progress, how it grew. I'm trying to figure it out because I'm still trying to work out iMovie. For some reason, when you have pictures from iPhones, they move, so the pictures are moving really fast, like they're not staying. So I'm trying to get that figured out. If you have any iMovie tips, I am open, but I will be on YouTube trying to figure out some iMovie tips in the meantime, so I can get these pictures out to you guys. So pictures of my x-rays, pictures of my toe growth, and a video of me walking across the room, if I can get my husband to record me sometime soon. Those are the things I will get to you guys next week before Friday. So like I said, it's day 107, but I'm doing okay. I have my what is it called? I have my knee scooter still, but I barely use it. I'm actually to the point where I am walking almost a mile. I take my nephew out every day for a walk around the neighborhood. So I'm walking almost a mile every day, unassisted. It's slow, not too slow, but and it, but I'm walking and it doesn't hurt too bad. Sometimes my feet get sore, sometimes my foot will swell up just a little bit, but Dr. Lam says that using your foot is good to stimulate growth. So I've definitely been using my foot. Sometimes I use it way too much. So knee scooter, I use it to go from the car back to my apartment, or from my apartment to the car, and that's about it. I keep it in the car any other time. So I look forward to hearing from you guys, and I hope I answered some questions that you guys had burning, and let me know if I left anything out. Talk to you soon. Bye.